Evidence of opioid abuse can be very difficult to determine, especially early on in the disease. Some of the things that might be warning signs to friends and family members include change in behaviors, change in interest level of normal everyday activities, and perhaps starting to let go of some of the activities they used to engage in on a regular basis. As this disease progresses, what we might see is more aberrant behavior related to individuals seeking out medications from other sources and/or drugs off the street. If you find evidence of them using other substances on top of previously prescribed medications, if you see evidence of individuals going to excessive measures to obtain new opioids and/or other drugs, and ultimately, if you're seeing secondary effects from law enforcement getting engaged, all of these can be major warning signs and should be addressed. In general, addiction rates are fairly low in individuals who take their medications for the short time period with limited doses. Everyone is technically at risk, and when we select for the right populations to provide these medications in, the risk is low, well under 10%. If you have the right risk factors, meaning the right age, the right predisposition, the right personal or family history, the risk goes up. And so it's imperative that physicians work with you as a patient to make sure that we've got the right dose for the right time length and for the right diagnosis. Common signs include a patient's disinterest in normal everyday activities, changes in behavior, and what we frequently see is individuals will try and hide evidence of this early on in the course. Inevitably, it will start to manifest in other ways. Many times family members find their loved ones unwilling to participate in things they used to do before. Sometimes they find them hoarding drugs. Sometimes they find them doctor shopping. And if you're seeing signs and symptoms like that, notify your provider. As the addiction progresses, a lot of times there's problems with law enforcement and potentially even overdoses, decreased respiratory status or ability to breathe, problems with medical complications related to opioids such as significant constipation, things like that can be signs that there's perhaps too much drug and an underlying source being driven by addiction.